Hello, my name is Dr. Fateh Srajeldin. I am a naturopathic doctor in the city of Toronto for the past 22 years. I have studied here in Toronto at University of Toronto, and then continued at the Naturopathic College, and been the head of the Naturopathic and Allergy Clinic for the past 22 years. Infrequently, people call me and ask me about the treatment of cancer. And a cancer is not an easy topic just to discuss on the phone. It is a topic that should be always discussed in the presence of information, such as the actual patient, the blood work, lifestyle, and all these things, so that we know what's happening with this patient. My clinic is the largest naturopathic and allergy clinic in North America. And I'm not talking about the size of the clinic, I'm talking about the experience all our doctors and ourselves that have in the treatment of cancer and other ailments that we come across from day to day. Our treatment of cancer comes from United States, from Germany, from France, some from Italy, and from Mexico. Then we bring it here and we tailor-make every treatment for a patient based on so many information that we get from the patient. The whole idea of the treatment of cancer, number one, is to stop the division or the increase of size of cancer cells in the body. Aim number two is to choke the blood supply coming to those malignant cells or to the malignant area, using treatment that capable of doing such thing. And lastly, it is very important that we involve diet. Diet is the most important factor that the whole treatment really pivot on this aspect. Because a patient who does not take proper care of diet during the time of cancer treatment is a patient who does not want really to be treated. That's why I make it really important for every patient to follow diet. Sugar feeds cancer, and coffee makes the environment very acidic into the body. So a patient who wants to drink coffee while he has cancer, or eats sugar for any reason, is a person who really does not pay attention to the physiology of the body. That cancer feeds on sugar and needs acidic environment. That we use a diet that really shifts the body from acid to base. What we want in the whole treatment is to reduce the size of the cancer cells and achieve good results at the end. To do that, we employ intravenous treatment that aims at cancer cells to reduce again its size and give us better control over cancer. Number two, we use oral treatment, and oral treatment is taken every day, and we employ diet. The IV treatment will be done based on the status of the blood work. Normally, I request CBC and liver enzymes, and I look for cancer markers, CEA, alpha fetoprotein, all these to give me an idea how strong is the cancer, and how is it progressing inside the body, so we know how many treatments to give the patient every week or every day or every other day. It depends on how efficient, or rather how aggressive is the cancer. Once I see the blood work, I determine the treatment. We have three types of cancer patients. One type are those people who have cancer but never had any chemotherapy or radiotherapy. their treatment will be definitely based on IV and also oral treatment and diet. But how many and how frequent, it is based on that patient's blood work. There are other type of cancer patients who have been diagnosed having cancer, started to take chemotherapy and radiotherapy, and then they asked me to implement my treatment. Normally, I would rather not do any treatment. Rather, I would like to preserve the body from deteriorating during the treatment, which means when the person has this cancer treatment, whether it is chemo or radio, my treatment will be just to make sure to embrace the body, the liver, the lungs, the lymphatic system, the immune system from deteriorating. And a lot of time you find if there is any bad results will come from a side effect of the treatment, not from the primary reason. So basically this is the treatment that we want to use in these cases. So and the last one is a person who have had cancer treatment, chemo, radio, and then at the end they said to him, you know what, the treatment's not working, we have nothing else for you to do. And this is what happened with one of my patients who came from Cornwall, Ontario. He had non-Hodgkin's lymphoma in his neck. And as soon as I examined him and looked at his blood work and I found out that he needs a treatment every other day. Cornwall, Ontario is 500 kilometers away from Toronto, approximately 500. So, but I had to do the treatment. I had no other choice. I had to overlook the distance and overlook everything. His life was more important. So I told him he has to come back every other day. He was driven to Toronto every other day by volunteers. Over 1 month, we did 12 treatments of IV and oral. His cancer reduced or shrunk from the size of a baseball to the size of a golf ball. The surgeon was able to remove that cancer at that point, which was difficult at the beginning, and gave him the surgery, removed the cancer. Today marks approximately 1.5 years. I saw him a week ago when I was visited on Cornwall, Ontario, and he's doing very well and does not need much of attention and much of treatment. The best example of cancer treatment, I tell people, it's like a snowball rolling downhill. The more this snowball rolls downhill, the more it picks up snow and becomes larger and larger. To stop this snowball before it comes and destroys everything in its way, we have to get it to stop. We have to find out the best way to stop it. And this is the case with cancer. We don't want it to increase in size. We have to reduce its size, and we have to treat it while we are in control with our own schedule, our own timetable, and our own tools. We're not going to respond to cancer. The word detoxification and all these things, I don't use them in these kind of treatments, because I find this is very essential treatment that we have to treat the system completely with our treatment and with whatever organ available to work with us, such as the liver, the lymphatic system, or the immune system. This note today was only a note to give people little light on the treatment of cancer, the type we make here in Toronto at our clinic. Wasn't intended to be a treatment, wasn't intended to tell people to treat themselves in one way or another. Every treatment in our office must be diagnosed based on that one patient, not on what we hear on paper or what we see in blood work alone. It is essential that everything work together. I extend 15 minutes, 20 minutes complimentary discussion for those people who have a question. You can call our office at any time and ask for 15 minutes complimentary discussion. We don't charge for that simply because it's a question. People have to say, oh, does this doctor know what he's doing? Or does he just gives hogwash? Or does he know what he's doing and I want to deal with him? Or do I like him or I don't like him? It's very critical that people know who they're dealing with. So if you want to call us, our phone number here at the clinic, 416-207-0207. We work 6 days a week from Monday to Saturday. Sometimes we extend our hours for those people who are critical care or need critical treatment. Also, you can view my website and read a couple of articles I wrote about cancer. And it is www.inaturopath, INATUROPATH.ca. Hope that this gave you some information. I hope you never get sick and none of your loved one will be sick. But should you come up with a question, please give us a call. Thank you.